Hello, my name is Carl Cooper, and I'm the project manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability, and this is our presentation, Health Insurance Jeopardy, Round 2, Double Jeopardy, Part 4, Paralysis. For those of you unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it is the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. I always say that when a consumer is looking at plans on the ACA marketplace, it is like playing a game of Health Insurance Jeopardy. I say that because those of you familiar with the game show know that in Jeopardy, it's not about the answer, it's about asking the right question. And consumers need to make sure they are asking the right questions about the plans being offered in order to make an informed choice. So let's play our game. For our Double Jeopardy categories, we are looking at some of the disabilities covered in our population-specific fact sheets. And today we're going to be looking at paralysis. Our $400 clue: stroke, multiple sclerosis, spinal cord injury, traumatic brain injury, cerebral palsy, and spina bifida. The question: what are some common causes of paralysis? Moving on to our $800 clue. This is the type of doctor who specializes in physical medicine and rehabilitation. The question: what is a physiatrist? And as is the case with most of these providers, we need to make sure that the individual's provider that they see on a regular basis is going to be in the network of providers in the plan that they are looking at. The $1,200 clue. This is the difference in therapies between someone born with paralysis versus someone who is paralyzed later in life. The question: what is habilitation versus rehabilitation? And the difference between habilitation and rehabilitation is just that simple RE at the beginning of the rehabilitation. Rehabilitation is getting back something you've lost, whereas habilitation is trying to acquire a skill that you never had. The thing is, even though a lot of these therapies that are associated with rehabilitation and habilitation are exactly the same, provided by the same exact providers, they are dealt with differently by insurance companies, and many times insurance companies will pay for rehabilitation but won't pay for habilitation, or will do it in a very different way. So you need to make sure understanding exactly what brought the individual to where they are and knowing whether it's habilitation or rehabilitation, and then looking at how the plan deals with those is very significant. The $1,600 clue. In addition to rehab or HAB therapies, these are other critical healthcare services a person with paralysis needs to have access to. The question: what are durable medical equipment and disposable medical supplies? And these are handled many times very differently by different insurance companies. The out-of-pocket costs associated with these can be very burdensome on the individuals, especially when you're talking about wheelchairs. So it's something that you're going to want to make sure that you're looking at all those issues and how the cost is going to affect this particular individual, and making sure that, once again, paying a little bit more in a premium may end up helping that individual in reducing their total out-of-pocket costs over the long haul, and therefore will be a much better deal for them, even though they have to pay a little bit more each month. If you need more information on rehab or HAB therapies or disposable medical supplies or durable medical equipment, we do have other videos that I would encourage you to check out. Our $2,000 clue: infections, bladder and bowel management, chronic pain, respiratory health, and depression. The question: what are some common secondary conditions for people with paralysis? As it was the case with some of the other disabilities we've talked about, paralysis is no different, that many times there are other co-occurring conditions that happen, and it's not just the paralysis that needs to get treated, but some of these other co-occurring conditions, and you want to make sure that those are handled as well by the plan that the person is considering enrolling in. If you haven't already seen it, be sure to check out round 1 of our Health Insurance Jeopardy presentation, where we address topics such as prescription drugs, medical devices, rehabilitation and habilitation therapies, Medicaid eligibility, the summary of benefits and coverage, and mental health. Those can be found on our YouTube channel at the link provided on this slide. If you're interested in finding out more about the NDNRC, you can check out our website, www.nationaldisabilitynavigator.org. You can also find my contact information on this slide. Feel free to reach out to us if you have questions as you're assisting an individual with a disability enroll in health insurance. Also, please subscribe to our channel to get more helpful videos like this one, and if you're interested in learning about the other disabilities listed, be sure to check out the links in the description below to access those videos. Thank you.